On my kicker tonight, it still frightens me to recall covering the outbreak of Ebola in northern Uganda nearly 2 decades ago. I remember walking into the crowded isolation ward in the St. Mary's Lachor Hospital in Gulu, seeing patients struggle, some of them through their last moments of life. Then I remember observing one tireless doctor dashing from one end of the crowded ward to the other. He then moved to another isolation tent where one patient, a clinical officer or nurse he was bleeding close to death because of Ebola. The boundless energy and dedication of this doctor nearly moved me to tears. He still found time in the middle of that mad rush for an interview with me. He explained that he was the only doctor at the Ebola isolation wards, and some of his assistants were down with a deadly disease. The name of that doctor was Dr. Matthew Lukwiya. After returning to Kampala from Gulu, news came through that Dr. Matthew Lukwiya had died of Ebola. Dr. Lukwiya is today spoken of in legendary terms, a hero of the war against Ebola and a medic that paid the ultimate price for his dedication to duty. It is my recollection, watching Dr. Matthew Lukwiya working tirelessly in an Ebola ward in Gulu, that comes to mind when I think of our own Kenyan health workers and the fight against COVID-19. Today is the eve of Labor Day, and it has taken the ravages of coronavirus for the world, and specifically Kenyan, to appreciate the place and importance of all those workers in the health sector. Never before has a country so collectively listened to a section of its professionals as Kenya is listening to its health and medical experts today. In his address to the nation the other day, President Uhuru Kenyatta repeatedly stated that further measures on relaxing restrictions will be informed by the opinion of, quote, our experts. Those experts are without doubt our public and medical professionals. For health and medical professionals, this is rare. They are shaping in broad terms the destiny of the nation. They are holding in their hands the fate of an entire country in the same way they would that of an individual patient. It is doctors, nurses, clinical officers, medical assistants, and related support teams that include cleaners and ambulance drivers that are currently running the show. For a country that is used for looking for answers to all its problems in politics, coronavirus has become an eye-opener. We have turned to professionals and not to political rallies in Uhuru Park or Tononoka. And we are considering qualified expert opinion and not some suswa or capcated declarations. Coronavirus has made us discover and appreciate our health and medical practitioners not as our private doctors, but as a national resource. Yet, we have not always treated them with the dignity they deserve. We have often subjected them to the humiliation of negotiating their terms of service through strikes and street demonstrations. In recent times, right in the middle of this fight against COVID-19, nurses, clinical officers, and laboratory technicians are having to threaten to down their tools so that their demands that include provision of personal protective gear be heard. This Labor Day, we must not just celebrate, but also listen to our health and medical workers. As the frontline soldiers in the war against coronavirus, they have been selfless in their commitment to duty. Our appreciation of these health workers must go beyond the welcome gesture of clapping for them on certain days of the week. They must be provided with protective gear, motivated with, say, a bit of those flowers that were sent to England, and given their space to do their thing. From the experience of watching the late Dr. Matthew Lukwiya, fighting Ebola in northern Uganda, we owe our doctors, our nurses, clinical officers, and other health workers respect and gratitude for their commitment and sacrifice to the mysteries of the medical profession. That is my kicker.